Hello, it's Dr. Keady. I get many feedback and many questions from many of you guys that read messages, text me, email me asking, am I going to get sick with this medication? What kind of proven record do we have? How long have they been out? So, first medication we came to market was Ozempic 15 years ago. We started prescribing this medicine mainly for patients with diabetes. We noticed wonderful weight loss. But again, back then we were saying, why are people losing weight? So we're all wondering about that. Yes, the A1Cs, the blood sugars were getting better, but the people were losing weight and we didn't know why. To look at that, finally, they went back and they looked and they realized the drug, the GLP-1, was causing hunger cessation. So therefore, patients were losing weight. And they created Wegovy. FDA approved, the drug comes out, and we're using this medication. So that drug is about 5-6 years old. After that, Eli Lilly decided to make this beautiful drug called Mounjaro that is mainly for patients with diabetes. That drug works great because it has two different receptors. And remember that these medications, GLP-1 and GIP, you do make it in your intestine. The problem is when GLP-1 is made, goes out like a little bubble and gets crushed very quickly. It does not last. Imagine if it lasted for a long time, we will all be skinny, we will all have beautiful blood sugars, and we all had a lot of goodies. But no, it dies. So these drugs are exactly that. So as I was telling you, Mounjaro comes out, and then right after that is Zepbound. So it's the same thing as Mounjaro, but now indicated mainly for patients that want to lose weight. Now, if you have obstructive sleep apnea, that's one qualifying disease that you might get this medication approved. But remember that you have receptors all over your body for GLP-1. So while you feel that GLP-1 is helping you hunger, it's also helping you to pay better attention, to have less hunger, to be a little happier, yes, they have found that some patients actually stop drinking. Matter of fact, I have a patient in my program that she doesn't want to leave the program because if she does, she doesn't get any more medicine, she will go back and drink again. Alcohol is a problem for her. I have another one that feels wonderful and now he's able to interact with other people or have more friends because he's happier on the drug. So all this is being studied, and we're referring back to the clinical paper that was published in JAMA about patients with dementia, that we found 30% less dementia in the cohort of patients that were taking a GLP-1. So GLP-1 should be put in the water.